This video is going to be about hepatic encephalopathy. Hepatic encephalopathy is a complex neuropsychiatric syndrome characterized by disturbance in consciousness and behavior, personality changes, fluctuating neurological signs, asterexis, and distinctive EEG changes, electroencephalographic changes. Biochemical basis of hepatic encephalopathy. Normally, the CO2 will combine with ammonia, that is NH3, in the liver and it forms urea. But here the liver is not functioning. Okay, so the CO2 does not combine with ammonia to form urea. So the ammonia is going to accumulate in the blood because it is not getting utilized. So that is the reason behind hepatic encephalopathy. There are certain precipitating factors, as in like summa இருக்கும்போது the hepatic encephalopathy is not going to happen. So there are like four precipitating factors. The first one is increased in the availability of nitrogen. For example, like ammonia. Ammonia வந்து NH3, right? So like one nitrogen and three hydrogen. So increase in the nitrogen load. As in GI bleeding, which is the most common precipitating factor, excess dietary protein, because like proteins have amino acids have nitrogen and ammonia and stuff. And third is azotemia, and then fourth is constipation. Electrolyte and metabolic abnormality, hypokalemia, hyponatremia, hypovolemia, hypoxia, and alkalosis. So all hypo, okay, and pH alone is hyper, but like sodium, potassium, water, and oxygen, all these are hypo. Okay, and then so that is electrolyte and metabolic abnormalities. The first precipitating factor is going to be increased nitrogen load, and among that, the most important one is going to be GI bleeding. That's the most common one. And second one is electrolyte and metabolic abnormality. Third is drugs. Drugs include excess of diuretics and sedatives. Others include infection, surgery, superimposed acute liver disease, portosystemic shunt, progressive liver disease. That's right. Clinical features of hepatic encephalopathy. Macrographia is an early feature. Trail making test. Neurological signs include asterexis, rigidity, hyperreflexia, extensor plantars. Symmetric high voltage triphasic slow waves 2 to 5 per second on EEG. Triphasic. Okay, remember the person has hepatic encephalopathy, so like they behave like onion because like they have personality changes. So like onion had three personalities, right? Ambi, Remo, and onion. So it's going to be triphasic slow waves. Disturbances of sleep with reversal of the sleep-wake cycles are also there. Is one of the earliest sign of encephalopathy. So like the person says that I'm not able to sleep properly and stuff. So like disturbance in the sleep. Alteration in the personality, mood disturbance, confusion, change in the handwriting are also seen. So like the person is not able to sleep, the handwriting is getting progressively worse. And then feet or hepaticus, musty odor of breath and urine is due to mercaptans. So the person actually, the breath smells sweet, that is fetor hepaticus. Okay, musty odor of the breath and the urine, it's because of mercaptans. A laboratory feature, serum ammonia level is high because like ammonia is the reason behind hepatic encephalopathy, so obviously the cause is going to be high. CSF is normal. I mean, we think that the person has some sort of neurological complaint, but then, encephalopathy, but then the CSF is completely normal. CT scan of the brain shows cerebral edema in stage 4. So, apparently, we have stages of hepatic encephalopathy. In the stage 4, there will be some cerebral edema. And then typical EEG abnormalities are seen. We know the triphasic pattern, symmetrical triphasic high voltage slow waves 2 to 5 per second. Slow waves 2 to 5 per second. Okay, so that was about the lab findings. And then we need to know two main things. Okay, trail making test and coagulation factors. About the trail making test, it's a helpful measure of hepatic encephalopathy. It's a careful mental status examination and use of trail making test which consists of a series of 25 numbered circles and that the patient is asked to connect as rapidly as possible using a pencil. Okay, so like number 1 to 20 on the circle போட்டுட்டு we're just asking the person to connect it as rapidly as possible using the numbers. That's called the trail making test. About the coagulation factors, the lab prognostic markers in patients with acute liver failure include the following. Prothrombin time comes under the King's criteria. Clinch's criteria have factor 5 levels and INR also is present separately. So prothrombin time, PT factor 5 and INR. PT factor 5 INR. PT factor 5 INR. Thanks. Clinch's criteria factor 5.